Let us finish the anatomy of the breast in this video. We will do this under the following headings. We will start with the brief introduction, then we will look at the situation or the location of the breast, then we will look at the extent, and then we will go into the most important topic, that is the structure. We will see that under the headings skin, parenchyma, and the stroma. Then we will move on to the blood supply, which includes arterial supply and venous drainage. Then one of the most important topics, that is lymphatic drainage of the breast. And finally, a clinical anatomy. Now, coming to the introduction. So what is breast? Breast, as we all know, is also called as the mammary gland. It is nothing but a modified sweat gland. A modified sweat gland. It is well developed in females, but it is rudimentary in males. The main functionality of breast tissue is to produce milk during lactation, which serves as nutrition to the newborns. Right? So there's nothing much about introduction of the breast. We will move on to the situation. The situation is pretty simple. The breast is situated in the superficial fascia of pectoral region. Now, when you're dissecting the cadaver, once you cut open the skin, once you make the incisions and reflect the skin over the pectoral region, you will reach the subcutaneous fascia, right? Which is also called as the superficial fascia, the main content of which is fat. In females, it consists of the mammary glands. In males, it is rudimentary, as we already discussed. Now, the extent. Superiorly, the breast tissue starts from the second rib, and inferiorly, it goes up to the sixth rib. Whereas, medially, it starts from the lateral border of sternum, pretty much like the pectoralis major, and medially, it goes up to the mid-axillary line. So that is about the extent of the breast tissue. Now we will go into the structure, which is the actual gross anatomy and a bit of histology of the breast glandular tissue. Now, the breast can be divided into 4 quadrants. Okay, so these are named as upper medial, lower medial, lower lateral, and upper lateral. There is no anatomical division here. This is just for convention in surgeries and other pathological definitions. We use the lobes. Now, coming to the skin overlying the breast tissue, there are certain special features in the skin of the breast. There is a conical projection at approximately the center of the breast, which is called as the nipple. And this nipple is surrounded by a hyperpigmented layer of skin, a circular region of skin that is called as the areola. Okay, so this nipple has been pierced by 15 to 20 lactiferous ducts. These are the ducts which drain the mammary glands. Now the areola contains enlarged sweat glands around its periphery, especially around the periphery. This is the nipple and this is the areola. There are enlarged sweat glands around the margin. Now these sweat glands during pregnancy, they become more hypertrophied due to the action of hormones, and these are called, these hypertrophied sweat glands of the areola, these are called as tubercles of Montgomery. This is one of the signs of pregnancy that you look for in a pregnant woman. Now, this is about the skin covering the parenchyma, the breast tissue. Now, let us look at the actual glandular mammary tissue, otherwise histologically called as the parenchyma. Now, each breast consists of multiple lobes of mammary tissues which have alveoli, like these. There are multiple alveoli. Now, these are called as alveoli, which are the actual milk producing tissues, and these are the ducts which drain them. And each duct, the entire thing is a duct, each duct at its terminal end, just before it penetrates the nipple, dilates to be called as a lactiferous sinus. Just before the milk is ejected out of the nipple, the milk is collected in the lactiferous sinus, and then it penetrates the nipple to open to the outer environment. Now, this is one lobe. There are around 15 to 20 lobes in each breast. So this is the gross anatomy. Histologically, you need to know the lining of each of these. Now, coming to the alveoli, alveoli, as you all know, is a secretory tissue. Now, for any tissue to be secretory, it usually contains columnar epithelium. So you can say that the alveoli of lactating breast is lined by columnar epithelium, whereas a non-lactating breast, as in puberty, is covered by cuboidal epithelium. Once it begins to lactate, just before it begins to lactate rather, it converts, the cuboidal epithelium is converted into columnar and the secretory activity begins. Now, whereas the ducts are mostly lined by cuboidal epithelium, whereas the terminal parts are lined by keratinized squamous epithelium. Now, wherever there is presence of squamous epithelium, the tissue is more tough, whereas cuboidal and columnar are not very tough tissues. Okay, so majority of the columnar tissues are present wherever there is a secretory function. So this is about the glandular tissue, a little bit about the histology as well. You need to know the lining epithelium of each of these. Okay, so the alveoli are lined by columnar epithelium in their secretory phase, whereas the non-secretory phase, they remain cuboidal. And the terminal parts of the ducts are lined by keratinized squamous epithelium. Okay, so that is about the parenchyma. Now, each lobe is separated by a fibrous septa, and these septa are called as suspensory ligaments of Cooper. Okay, so that comes under the stroma. So we are done with the skin and we are done with the parenchyma. Now let's look at the stroma. Histologically, stroma means the background tissue. This actually forms the bulk of the organ everywhere. So whenever you hear the term stroma, it means the background, the tissue that is present extensively in the particular organ. Here, the stroma is divided into two. One is fibrous and the other is fatty. Now, if this is the approximate structure of the breast, the deeper structure will be the pectoralis major, covered by the deep fascia of the pectoral region, right? And this is the nipple, and this will be the areola. Now, when I say the fibrous stroma, let's imagine that this is one of the lobes. The fibrous stroma actually comes as a projection from the deep fascia of the pectoral region and covers each lobe like this. It separates the lobe from the surrounding fatty tissue and from other lobes. Okay, so that is the fibrous stroma. The pectoral region, the deep fascia of the pectoral region sends ligaments into the breast tissue, which is nothing but the fibrous stroma, and they have a special name, that is ligament of Cooper. Suspensory ligaments. So what do they suspend? They suspend the skin to the deep fascia. So this is why am I stressing about this is, in case of carcinoma of the breast, if there is a tumor in the breast, these will be invaded as well. The fibrous stroma will be invaded, the suspensory ligament of Cooper will be invaded, and it pulls the skin inside. So there will be dimpling of the skin. Wherever there is a tumor, there will be dimpling of the skin, and the appearance of that breast has a particular name, which we will look at in the clinical anatomy. So under stroma, the fibrous stroma, the suspensory ligaments of Cooper are important. Now the fatty stroma is pretty simple. It forms most of the bulk of the mammary tissue. So this is nothing but the subcutaneous fat that's present everywhere else inside the breast. This gives the shape, the globular shape and the curvature of the breast. So that is about the stroma. So that finishes the structure. Right? Now let us go into the blood supply of the breast, where the arterial supply is quite important, because in case of mastectomy of breast carcinoma, you will have to ligate the arteries that are supplying the breast. Now, if this is the breast tissue, the arteries supplying the breast tissue come from mainly the subclavian artery, then the axillary artery, and the posterior intercostal arteries. Okay, so the major branches supplying this are the lateral thoracic, the internal mammary, and the thoracoacromial arteries. Okay, and these are the branches of axillary artery. The internal thoracic is a branch of subclavian. I'll name the arteries. This is the internal thoracic artery, and these two are the lateral and thoracoacromial arteries. Lateral thoracic and thoracoacromial. These two are branches from the axillary artery, whereas the internal thoracic, it is also called as internal mammary. It is a branch of the subclavian artery. One important point about the internal thoracic or the internal mammary artery is this is one of the best suited conduits for coronary artery bypass surgeries. So that is something that you need to remember. Okay, so these three are the major arteries supplying the breast tissue. The veins are nothing but the same, they carry the same names as the arteries. The superficial veins drain into the internal thoracic vein, whereas the deep drain into the lateral thoracic, axillary, and the posterior intercostal veins. So the venous drainage is not that important. Now coming to the Lymphatic drainage. This is a very important topic because in case of carcinoma of the breast, you must know where the breast tissue is draining into, because this forms a pathway of metastasis of the cancerous tissue. Now, the major part of the breast drains into the axillary group of lymph nodes. Now, there are many subgroups in the axillary group of lymph nodes, but the major portion of the breast drains into the anterior group in the axillary. Anterior group of axillary nodes. So in case of mastectomy post carcinoma breast, all the axillary nodes have to be removed along with the breast tissue. Next, some of the breast from the superior lobes drain into the supraclavicular group. This is the supraclavicular. And some from the medial lobes drain into the parasternal group. This is the parasternal. Now, in your examinations, you have to mention about the anterior group of axillary nodes and the parasternal nodes and supraclavicular nodes. So this is the lymphatic drainage. So we are done with the blood supply, we are done with the lymphatic drainage. Finally, let's have a look at the clinical anatomy. So most of the clinical anatomy, we deal with the clinical features of carcinoma breast. Okay, so as a doctor, the most important thing that you need to know about the breast is, if a patient comes to you with a complaint of the breast, you have to know the clinical features of carcinoma of the breast, CA breast. So, as I discussed in the stroma, the fibrous stroma of the breast is called as the suspensory ligament of Cooper, right? So, whenever there is a carcinoma of the breast, or rather any benign tumor as well, the ligaments of Cooper will be invaded, and this forms dimpling of the skin. Even before you are able to palpate the tumor, the dimpling of the skin will be prominent. This will be visible. So the patient might come to you with skin changes, particularly dimpling. So as a doctor, when you observe the skin, you will find what is called as the pudgy orange appearance of the breast. So the breast, it appears as the skin of the orange, which has dimplings all over it. This is because of the invasion of the suspensory ligaments of Cooper by the tumor. Now the next is retraction of the nipple. The pathology behind this is exactly the same, because of invasion of the suspensory ligaments of Cooper. Now, any skin changes, color changes of the skin, it can be erythematous, it can be bluish, whatever. Any color changes of the skin, it should indicate some kind of a neoplasm. Neoplasm is, it can be malignant or benign tumor. So this is about CA breast. Now the next important one is mastitis, which is inflammation of the breast tissue, or in particular the nipple maybe. This is seen in lactating mothers. This is seen in lactating mothers. It's the most common cause is infection by Staph aureus. So this is another clinical point that you need to remember, and you need to know some of the investigations that are done. One is mammography, which is mostly done. It is an imaging technique which uses X-rays to image the mammary tissue. It's mostly done in case of neoplasms. And the other investigation is FNAC, fine needle aspiration cytology. If you find a mass, first you take a fine needle aspiration of it and send it to cytology, which will give you a diagnosis. Further, you will decide the course of treatment based on the diagnosis of FNAC. So these are the clinical anatomy, which is points of clinical anatomy which are important for your examinations as a first year undergraduate student. So that covers the breast. So in the next video, we will go into the axilla.